Hi, Jessie. Thank you very much for spending your time with us to tell our audience about your story. Very curious about you. You were working for the airlines and you suddenly come in Chinese medicine. And we know each other through the Chinese medicine program. What made you make this decision? What made you interested in TCM?
Well, I've actually been interested in Chinese medicine for a very long time. It was more for a personal. I've actually studied, I guess, nutrition for a long time. So my father was a chef. And so ever since I was a kid, I used to cook a lot. And so one of the major things about Chinese medicine is with diet, like
Mm-hmm.
dietary things, and actually managing health through better diet. So, but I've always wanted to maybe learn a bit more, especially on herbs, other things to take care of my health, or at least that of my family immediately. I have met quite a few TCM practitioners and asked them if they're willing to teach me, and everyone told me, yeah, you need to have a foundation or at least a basic background. Otherwise, they don't know where to start. So like one of the recommendation was to go back and at least get a basic foundation. And then which is why I decided to go in the program and kind of do that.
So when you're little kids, because your family reasons, you begin to interest in food and nutrition, and then you decide to have a good foundation for that kind of knowledge, so you can do more with that.
Yeah, something like that. I mean,
Okay.
there's other reasons, but yeah.
It's not like you have some experience and you feel that the Chinese medicine will help you, and then you jump into this area.
I didn't. I did actually. So I've had my gallbladder removed about back in 2018 due to
Mm-hmm.
gallstones. So cholecystitis. It took 3 years to get diagnosed. Being a flight attendant, I traveled a lot. I've had to go to the ER on 4 different occasions due to just pain. And it was, obviously I found out later it was just stones passing through the bile duct. It's
Mm-hmm.
excruciating. It felt like, literally, it felt like having a knife cut through my entire
Mm-hmm.
stomach. Well, and it kind of is that because when you have a small stone going through the bile duct, it really is a stone kind of cutting through the bile duct before it goes into your small intestine, right? So your
Mm-hmm.
gallbladder kind of squeezes out the stones and they pass through the bile duct into the small intestine. That whole process is excruciatingly painful. So I've experienced that for about 3 years. During that time, I went to a lot of different hospitals, again, to different countries. This includes South America, Japan, twice in the US, like none of them can diagnose me. No one knew what was wrong with me. They said, we don't know what's wrong. When I went to China, again, I just went to see a Chinese doctor and they didn't diagnose me with gallstones, obviously. They did give me a diagnosis at the time in Chinese medicine since I didn't know what it means. They put me on herbs. I was better actually for about a year. I didn't have that problem anymore. I didn't have any stomach pains, didn't have any sharp pains. I thought I was better. So I kind of stopped taking the herbs after a while. I never really thought much of it. At the same time, I was seeing an acupuncturist here in the US. So between the two, it was well managed. So I thought it was maybe just a temporary thing, right? I didn't think much of it. So I stopped. And after about a year, I had another acute symptom. So that got me into a hospital. So after that visit, they did an ultrasound and said your entire gallbladder is just slush and stones. So at the time, I was in a lot of pain. I was under a lot of like painkillers as well. So they told me if I don't get that removed, there's a chance of acute infection, a stone cutting through, causing like internal bleeding, leaking. Like basically, I was coerced into getting a surgery, and I did.
Mm-hmm.
I wasn't really in my right mind. I was like, they pretty much scared me into a state thinking if I don't get a surgery today, I might die. In retrospect, that was kind of crazy because actually I lived with the same problem for 3 years and I didn't die. Clearly, that wasn't going to happen. But when you're in a hospital and you're told that you are kind of under duress a lot. And I do see
Mm-hmm.
that sometimes in the ER where they kind of tell you, you have to make a decision now. You have to do this, where you
Mm-hmm.
don't have time to really think, get a second opinion. Especially when you're in pain, your entire sensory changes. Like nothing matters except stopping the pain. You'll do whatever it takes to stop the pain. And I know that from a firsthand experience. And I know other patients will tell you when they're in pain, if you tell them doing this will stop the pain, they'll do it. Whatever it is, they really don't care. They just want to stop the pain. So
Mm-hmm.
a lot of times I don't think it's a bad thing. Like I think it comes from a good place, regardless of, what medicine. But I think sometimes it does kind of take away the patient's ability to make the right decision. So after I
Yeah.
got my gallbladder removed, again, the problem didn't go away. I still had similar problems, abdominal pain, bloating, all that. I just didn't have the stone pain anymore, right? But the same symptoms persisted. So when I started studying Chinese medicine, I actually learned why I had that in the first place. And again, I didn't fit any of the typical standard, according to medical type of what causes gallstones. So one of the things is you have to be obese, you have to have high cholesterol, people who drink a lot of alcohol, like there's certain stereotypes, right? Fitting certain criteria. So no one ever thought of checking for gallstones because I didn't fit the, stereotypical type of patients that would get this disease. And that happens a lot in biomedicine in that there's a framework. They'll tell you, you don't fit this stereotype of this illness. It doesn't mean you can't get it. You still can. It's just you have a different triggering factor. It presents the same way. So it's a matter of presentation. And a lot of times that leads to misdiagnosis, like in my case.
Mhm.
So at least when I started studying, learning more about Chinese medicine, I was able to know that there are ways to have done preventative things or things that could have tested in the beginning that would have really helped not only not have to get me to remove my gallbladder, but to have like really stopped it. Like because for the longest time when I was getting acupuncture and taking the herbs, I didn't have any of those symptoms, right? Nothing flared up. I didn't have any of that because again, at the time everything was managed. So that
Mhm.
management was just, it wasn't temporary. That management was in another way a band-aid. And it's one of those things that I have taken away, now being close to graduating and being mostly done with my classes in clinic, is that many of us use all medicine. And I mean this whether you're doing Chinese medicine or biomedicine, allopathic, and whatever you're doing, you have to understand they are a band-aid to help you get better. And the only way to get better, and every doctor will say this, is eat well, sleep well, have a better lifestyle and exercise. Why do we say that? Because when I was taking herbs and doing acupuncture, what it did is to have the stones not exacerbate, inflammation reduced. So I don't pass stones, I'm not in pain. So
Yeah.
Chinese medicine, acupuncture, all this, what we can tell you is, hey, you have to make changes. It's not a me thing, it's a collaborative thing. And with, that as I have learned, whether it's myself or patients, I always remind everyone at the center of health is you. You're the focus, right? You are the most important person in your health, not a doctor, not a practitioner, not anybody else, not your family, not your nagging wife, not your children who tell you you got to quit smoking or whatever. No, it's you. You have to be responsible for your health. No one else can be responsible for your health. So that's one of the things that I sadly didn't get when I was doing the Chinese medicine and acupuncture. No one sat me down and kind of said, hey, you have to make some changes and adjustment and did that whole
Mhm.
history. And it's something that I try to do, at least when I'm practicing, when I see patients in clinic, when I'm on my internship, I talk to my patients and ask them, what's your diet like? When do you go to sleep? What are some of the things that you do
Mhm.
to exercise to kind of see maybe there's a cause, right? There's always a causation. So
Mhm.
important to kind of eliminate some of that. And sometimes it'd be shocking, like when you tell people and they start making those small changes, they'll notice a big difference. And I think that's really important.
Mhm.
So, yeah.
Wow, thank you. I think that's very, very good information for us to know. So I want to start with something that I think a lot of women can really relate to. In traditional Chinese medicine, how do you view the menstrual cycle? What kind of woman's period actually tell us about her overall health? In Western medicine, we don't really talk about it in that way. I know TCM sees it very differently.
So, first of all, menstruation is a very huge topic. When we look at women's health, and this is definitely thought more of in Chinese medicine, there's actually a whole history behind it. Any textbooks, other things that relate to this. Women's health relates to the uterus and basically the ovaries and everything, the entire organ. For women, a lot of the hormones also play into that. So, in biomedicine, I think a lot of times it's less studied or less focused on, but in Chinese medicine, we tend to think of like menstruation, like the cycle, everything. We think of it when it's normal, when you're perfectly healthy. Like in biomedicine, they'll tell you it's every 28 days. That's a cycle, usually between 4 to 7 days for bleeding. The color should be red and not extremely profuse, but it goes from heavy to moderate to light. No blood clots, no pain before or after. It should be a smooth transition. What it really is our body shedding the lining that was originally going to be used for, again, if you were going to have a fetal implantation to have a child, right? When that doesn't happen, your body just kind of sheds this. A lot of times, what happens with most people, especially now with women, is additional stress, overwork, fatigue, other things, diet, things that causes, they're not necessarily like a huge problem, I guess, in terms of illness, but they're small things that would affect your menstruation or that would actually be telltale signs of maybe even potential pathologies that may happen down the road. So one of the most common thing I see in a lot of female patients is dysmenorrhea, which is a lot of pain that's before, during the period. Sometimes it comes a couple days prior, sometimes it comes on the day of, sometimes in the middle. All of that will tell us, maybe there's something that's wrong with the body as a whole. Because if you think about it from a Chinese medicine perspective, the blood isn't just the endometrial lining that's being shedded. The concept is liver stores blood. So it actually goes through a whole cycle. So it goes from the liver, the blood comes up, it goes
Mhm.
through actually the breast. So when women say
Mhm.
during PMS, right, premenstrual symptoms, one of the major one is actually breast distension, right? Chest pain,
Mhm.
feeling tightness in the boob. So what that is, so if you think about it, after when you give birth, right, when you're breastfeeding, milk is blood.
Mhm.
So where do you think that blood
Yeah.
normally goes? It actually comes out through menstruation. Why do you not menstruate when you're breastfeeding? Because the blood that you were supposed to bleed out is going to your breast to be fed to a baby. So it's still the same blood. Again, so a lot of times when women during that time when they're stressed due to work reasons, family issues, they argue with their husband and they get angrier, all that kind of
Mhm.
stays here. They just get stuck. They freeze in place. They don't go anywhere. That's what leads to a lot of women saying, yeah, I have breast pain, tenderness, even like cysts, like nodules, fibers, things like that. All of them are literally blood stasis. They're literally blood that got there. They were supposed to just cycle through and come back down. They never did.
Will it cause also breast cancer?
Potentially, it may. That's, again, a bigger topic. So if you had a lot of problem, again, these are benign. Usually when they start, they're just little nodules, blood stasis. They kind of stay there. They respect boundaries. The problem is sometimes when you have a lot of them and they have inflammation. When you have chronic inflammation, and even biomedicine will tell you this, chronic inflammation leads to cancer. What it is the inflammatory cells starts to mutate. When there's inflammation, mutation occurs to the DNA structure. So it's like if your body writes coding every day, right? When it makes new cells are the same repetitive coding. Well, when it's inflamed, it's not working properly. It's like, a little fireball that goes haywire. So imagine if your computer is frizzing out every 5 minutes, it's going to have error codings. So when it has errors, it leads to cancerous cells. Every day our body deletes these. Our body makes them on a daily basis. They make mistakes. We cancel them out. We delete them. But when you're constantly inflamed, when your body is constantly under stress, it makes them, and your body doesn't have enough time to clean them out. And so they stay and they create mutations. And so that kind of what basically causes all these inflammatory responses in the body. So that's why even in bowel medicine, they'll tell you everything we do is decrease inflammation, stop inflammation, because inflammation over time, when our body cannot deal with inflammation, what we do is we create granulomas. Like if you look it up, you'll see that granuloma is basically your body's white blood cell creating a wall around inflammatory cells and sealing it in. It's kind of like a little trash bag. They just kind of put it in a trash bag, tie it up, and be like, oh, let's put it here. Let's hope it goes away. It doesn't go away. It stays in your body. And over time, if other markers in your body are still inflamed, that bag is going to explode someday, right? When it does, all of them are going to come out. The moment they do, that's when we say it becomes cancerous because it doesn't have a boundary anymore. And that's another problem with metastasizing, because when that little cell, many of them starts going everywhere, they go everywhere. Again, they're going to replicate somewhere else and it just spreads. That's why we say cancer is a spreading disease. It starts.
I see.
With a lot of women, again, it doesn't have to lead to cancer. A lot of times what happens is during a menstrual cycles, right? We would say before menstruation, we recommend some dietary things, warm tea, especially like rose hip tea. One of the things I always recommend my patient to take, like rose hip, it smells aromatic. It actually helps move GM blood. And you really do, you drink them a bit. It helps regulate that. It makes you less angry. It helps the flow of blood. And that's kind of the whole point, is that when you start regulating and try to make the things flow better, they don't stay there, right? Think of your body. I think of like the human body as feng shui. So I would say the feng shui of the outside world is wind and water. The feng shui of our body is qi and blood. When they move in harmony, your body is healthy. When the qi and blood is not moving, think about it, right? It's stuck. There's pain, there's illnesses, everything comes when they're not moving. So we got to get that moving. And there are many ways to do that. Again, food, dietary, lifestyle choices, sleeping on time. A lot of these make changes. I think with modern society, one of the biggest problem with a lot of women is they don't have time, right? Time. They're constantly stressed, taking care of their kids, going to work, doing all this. They pile up so much stressors that their body is literally in duress. And our body hasn't evolved enough. Our body literally lives in a state of saying, oh, I'm still under duress all the time. So our body constantly thinks that there's a tiger chasing us because our body does not know what like stress from work is. But our body from thousands and thousands of years ago know what it's like to be chased by a tiger. So every time when something like shows up, like you got an email, a text message, something urgent, your body releases the same hormone endorphins as if you were chased by a tiger. When you have that every day, your body's like, freaking out constantly. So kind of the problem which, we see in modern day with a lot of people.
Okay. Mention the tea. I think I'm going to try it. And I have tried Chinese medicine like gua sha, cupping, or masbustin. All of this is actually helpful. How acupuncture works inside our body. I remember you have told me a story about acupuncture can change patients' blood pressure significantly in a very short time. How that works.
So I had a patient who came in, again, this is for different cases. He did have high blood pressure. It was over 90. Normally, this is an ER case. We would have to send that away. Because again, this is considered like metastatic hypertension. We don't usually keep these patients when you have high blood pressure over certain limits. But being that he told me this is just his normal. Some doctors might not take it because with licensing, with safety, with compliance. But I did ask him. He said that was normal. He said he feels fine. So I did a couple points on him for blood pressure. When we were done, we checked again, and the number, I want to say it was like 70 something. It came down enough to where he wanted to take a picture and write it down, go home to tell his family. Because I asked him, I said, this isn't too bad, right? Comparing to your biomed. He's like, no, this is much better. He said, I feel relaxed. I took a nap. 20 minutes later, my blood pressure dropped. And so one of the things about that is understanding what, people think is magical. It's not magical. It's the same as pain. So blood pressure, if you think about it, is when your body has a bunch of vasculatures, right? Our blood vessels. If you think about what they are, is you think of them as little tubes, right? When it comes the blood through the tubes and they go through the hose, they normally push at a right temperature to kind of get everything where they should go. But what happens to high blood pressure, right? It's basically when you have like plaques, when you have issues, like, when people say they have high cholesterol. What is that? Well, it's actually when you have fat along those tubes. It narrows the When that's narrow, you still need to get the blood through, right, to get to where you need it to go. So you got to increase the pressure to push it harder, right? It's kind of like if you open up a like literally you open up a valve and try to get water through. If your pipe is really dirty and there's mud on the inside, you have to turn it up higher, right, to get the same amount of water. Otherwise, you just get drops of water. So if you want the same amount of water through a dirty pipe, you got to turn up the water higher. So that's what high blood pressure is. It's your body will keep turning it higher and higher and higher. So that force will keep going through. So at the end, you get the same amount of water, right? But inside, it's causing greater pressure, right? That's basic science. When your heart keeps pushing really, really hard, it's taxing on the heart. That's why people with high blood pressure dies from heart attacks, because your heart's working harder and harder every single day. And you can't feel it. It just keeps pushing, right? The one thing about acupuncture, why it works so well, is that as it's pushing, right, it's squeezing down. With acupuncture, when we put in these needles, what they do is they kind of turn that knob down, because what they'll do is send a signal to your brain to basically turn that knob down. It'll actually, first of all, go to your brain. The moment the needle goes in, it sends a nerve impulse to your brain, say, hey, let's turn the knob down. And when it does that, it also causes vasodilation. So that little tube you had, they'll help with that relaxing. When it relaxes, it gets wider. So yes, the dirt is still there, but it gets wider so more water comes through. It also helps reduce the extra salt and water in your body through going through the kidneys. It goes through this whole system regulation to kind of decrease that. It relaxes your body, again, relaxing all these vessels, and leads to contraction to basically stop that flow from being so forceful. That's why you'll see the blood pressure go down. Does it fix the problem? At the end of the day, it doesn't fix anything. The mud is still inside, right? Once the acupuncture needles are out, you give it a little while, your heart's like, wait, we're not getting the blood flow again, at the bottom end. It's going to turn that crank naturally back up. So there are a few patients I've seen before in our clinic that will keep coming back to use acupuncture as a management. But the best way to truly manage this is to figure out, why do you have mud? How do we clean that mud? So a lot of times we'll use herbs, we'll use dietary changes to kind of get rid of the mud and prevent you from getting that in the first place. As you age, vessels become brittle, right? Vessels become weaker. These are normal. But what can we do to make sure it doesn't add extra layer of that oil and grease? What can we do to make sure it flows a little better? These are things that you can do through proper exercises, proper dieting, and some other changes. What we're trying to do, we cannot replace the pipes in our body. What we can do is slow down the damage that time has on our body. And I think that's really important, because a lot of times people like to think, oh, well, let me just go get acupuncture and, turn down the valve and then things work better. No, because I can turn down the valve and 2 days later, the valve is going to turn itself back up again, because you still need everything to get there. So it is a temporary patch. It's a different patch than, let's say, if you were taking drugs. But, at the end of the day, if you really wanted to become healthier and not be exactly completely reliant on anything, you really could do more with diet, things like that. We have a few patients who comes in every other week and their high blood pressure is very well managed. But that requires very rigorous diet change, lifestyle habit changes. If you were just going to come in to reduce blood pressure, varies from person to person. You might have to come in like maybe twice a week, 3 times a week, which you can. But to me, that's just a Band-Aid. It doesn't fix what made it happen in the first place.
Okay, so not just acupuncture, also diet, lifestyle, everything works together.
Yeah. I think acupuncture is just the one very quick, effective thing that you see immediate result, right? The same thing happens a lot. Like when I explain to patient about pain, people like to say, oh, how does acupuncture help with pain, right? So one of the things is, if your body has nerves and the nerve sends messages, right? These nerves carry messages so that when you, let's say you poke yourself, you feel it. Your brain says, hey, someone's poking you, right? If you hurt yourself, it says, oh, it hurts, right? But when acupuncture needle goes in, it sends a message that stops that signal, because it literally crossfires, it stops the signal, because your body overloads. Let's say if you start jabbing yourself everywhere, you don't feel it anymore, right? Or if you keep poking, after 10 minutes, you don't notice, right? Why? If you don't pay attention, like if you put pressure on something for a while, you forget there's pressure, because your body stops noticing it as a nerve message. That's why. So when you use acupuncture, you stop the sensation nerve being sent to your brain and you don't notice that. And the other thing it does actually is because acupuncture signals your brain to release its own natural painkiller. So our body, biomedicine have found this, our body creates its own painkillers. We actually do have endorphins in our brain. And when we release endorphins, it stops pain. So sometimes we actually take certain drugs to release our own endorphins. But basically what happens is when we use acupuncture, that needle sends a nervous impulse into our brain to release a large amount of endorphins. And that stops pain. And so it literally eliminates pain. That's why acupuncture works so fast. Are there cases where it doesn't work? Sadly, yes. So about 7 to 8 out of 10 patients I've seen for pain, this works. In the cases where it doesn't, nerve issues, brain issues. Yet have surgery, if you had metal, if you have replacement, other things, or if you have a nerve damage, congenital later, or even like people with certain type of brain problems, mental other issues, it doesn't work because your brain has lost the ability to receive and send signals, or something triggering it, right? So if you have a injury, let's say you have a metal here, well, the nerve get through the metal to your brain. It's, very simple. So some patients, it doesn't work as well. Like it just because that pathway was taken away from us, right? So we had to find other ways to help with managing that. Acupuncture have its ways of making things work, and there are also things where it doesn't work. But in most people, it works very well. It's very scientific. It's not hogwash. Like I've read things and heard from people like it's magic or it doesn't work on me. This never works or whatever. If it doesn't work, there is a scientific reason behind it. Whether or not we've discovered it, that's a different story. But there's always a very clear, defined reason for that. I think it's just important for us to find out what it is and to help a patient find out what works best for them. So it doesn't always have to be one thing or another. So
Okay.
yeah, in Chinese
Yeah.
medicine, we have a lot of modalities, right? From herbs to diet to, as you mentioned, like gua sha, cupping, moxibustion, needling, everything. There's so many other things. We even do like toina with like manual therapy. Again, all of these to get to the same result.
Yes, that's why I like Chinese medicine so much. People talk about feeling burned out, can recover no matter how much they sleep. I've always wondered, is that the same thing as what TCM calls kidney deficiency?
Yes.
Are we talking about the same thing, just different names?
Yeah. So that is actually kidney yang deficiency. We have a diagnosis for that. It's a full diagnosis. It's a complete one. In textbooks, we discuss this. Adrenal fatigue. So adrenal gland actually is correlated to kidney. So even from like biomedicine sense, right? So we don't see them as an isolated thing. So when you think about it, the adrenal sits on top of the kidney. We don't think of that as a separate thing. We think of that as a whole picture. In Chinese medicine, when we talk about an organ, we don't talk about one organ. When we talk about the heart, we don't talk about the heart. We talk about the whole cardiovascular system, the whole bundle from the heart to the lung. So when you talk about the heart, literally, we're talking about the vessels, veins that goes to the lung, gets the oxygen, that goes to even to the fingertips, your toe, everything. That's part of the heart. That's what the heart governs, right? We don't talk about just the pump in the middle. We talk about the blood flow that it carries from here to there and how it works. So in Chinese medicine, we think of everything as a big picture, as a whole system, not just one individual function. So with something like adrenal fatigue, it's something that where your body's fundamental energy is depleted. There's just, your body doesn't have enough energy. Remember what I said about qi earlier? Your body
Yeah.
doesn't generate any qi to help you move on. You can't sleep it back. This energy is not like ATP that you just crank it up and I'll keep making. No, it's something a little more deeper than that. It's something that your body, you're born with. When you look at little kids, they run around, you're like, wow, where did kids get all the energy to do that? Yeah, that's because they have a lot of yang. They have a lot of that energy. It's natural. It comes naturally. It's like the energy that we say that's from the sun, right? It's inherent. They are for it. When you get older, that's one thing about being older is that we hit a peak and we decline. As you get older, that energy decreases. That's normal. But sometimes, a lot of times what happens is steep falls. So if we don't take care of ourselves, if we don't rest well enough when we're younger, we use that up. In Chinese medicine, we say we deplete energy. What does that mean? When you're young, if you stay up all night, if you work really hard, if you do all these things, you tax out from this bank. Our kidneys have, like, again, kidneys, even in biomedicine sense, we say it decrease at 10% every 10 years. So it actually ages. It ages as we age, right? But sometimes we can slow that progression. But what happens if you say, I stay up all night, I drink alcohol, I do all these things that are bad, but your body's going to wear out. It wears out sooner. It borrows. We are always living on borrowed time. When you borrow from your body, one day your body's going to raise a little white flag and say, hey, yo, we have nothing left inside. Yeah, goodbye. We got zeros. And then you just crash, right? So when that happens, your body starts to get more stress. You get less energy and there's less ability for your body to control the hormones. So things kind of fall. And then you get this free fall moment where you're always tired, always fatigued, and you really cannot, get through the day. And usually what ends up happening with these people is that they are in a tired state. They're always tired. They wake up in the morning, they're tired, they're almost lethargic. They don't want to eat, they're not hungry, but they can't sleep either. Like sometimes they'll even get to the nighttime where they feel like they cannot fall asleep. Like they'll stay up, they'll get insomnia and they'll get like random thoughts, but they're just tired. It's because our yang, this is how yin and yang works. In the morning, yang rises, our body wakes up, it comes out. At night, that yang goes inside and our yin side comes out and stores the yang and kind of circles, right? So when you see the yin and yang symbol, you go yang to the yin and yin back to the yang. It starts in that cycle, right? What happens is in this case, we don't have any of that. The yang is weak in the morning. It doesn't rise. It just stays moot. And then at night, that yang starts flowing up. So it's almost doing a reverse of that. So basically, your body is doing the opposite that it should. You end up being very tired in the morning, throughout the day. As you get closer to the night, you get this weird second drive where you feel like you have more energy or you can't really sleep. And people end up with insomnia. So usually in that case, we use herbs and things to treat that. In that case, acupuncture helps a bit, again, to give you a little more, but it cannot nourish what's missing. The one thing in Chinese medicine that we don't talk about in biomedicine is actually nourishing. adding to the body, right? In biomedicine, we always talk about taking away. You're sick, we take away the virus. You take away the bacteria, right? You have cancer, we take away the tumor. You have something, we take it away, we take it away. But in Chinese medicine, we have something known as nourishing, tonifying. We add into the body. Why? Because sometimes you take away from your body just by living, right? You drain it.
Mhm.
You drain it out. So we have to add to it. How do we add to it? Well, food. Like one of the things that we do with herbs, diet, is to add into that reservoir. Because when you were young, you burned out all that stuff. So what do we do now? We try to add it back in little bits at a time. In that case, it's really important to see a TCM practitioner to have a differential diagnosis to be very accurate in what caused this in the first place. Everyone might be a little different. So kidney deficiency could be essence deficiency, it could be yin deficiency or yang deficiency or all the above or a mix. And that requires different herbs, different diet. But with just a small breakdown, with essence deficiency, usually when male gets older, they'll deal with impotency, urinary problems, the inability to, function in bed, or they end up with spermatorrhea, which is leaking of sperms. And they'll get low back pain, knee pain, soreness, things like that. People who tend to have like yin deficiency end up staying up, getting palpitations, feeling thirsty all the time, or insomnia. That's yin deficiency. With yang deficiency, they wake up in the morning, they're just tired, cold hands and feet. Like these are some telltale signs, but sometimes you will say, oh, I have all the above, or I have this, but I have that. So it will be a combination. So that's kind of part of aging. Everyone age a little differently. This is one of the times where I say, we're not created equal. We're all human, but everyone kind of is a little different. And it's important to pick out what those little differences are and be more targeted in what you have. But in general, in these cases, eating well is very, very important. So one of the most important thing on top of this with moxibustion, with you can do acupuncture to kind of help reduce your body's like stress mechanism to kind of get you into a more relaxed state. I know most people, every time when they come and I treat them and whatever, everyone will say, I feel so relaxed. I was able to, I feel better. Yes. So we literally kick you into a parasympathetic state. Instead of being that fight and flight and stress mode, we relax you. But once we relax you, your body still needs all that nutrients, right? So you got to go home and add these things in and kind of build on it. And it helps. Like, so I've known a lot of people, it doesn't matter if you do herbs or vitamins or diet or other things, you got to do something to kind of add into your body, right? So that's one of the things that biomedicine don't talk as much about. And I do know that sometimes nutritionists and other people will focus on, it requires you to know where you're like, what's wrong and where you are. So that's kind of important.
I also heard some people say you need to clean your body first, clean all the bad stuff out, then to add good stuff in.
Your body does that on its own. I personally don't believe in it. As long as your liver and kidneys working okay, as long as you go have a bowel movement, you're clearing it just fine. One of the biggest problems I do tend to see, even in clinic or cases, are patients who go overboard. Like they'll take a ton of detox things. They'll eat a lot of colon cleanse or a lot of like veggie juice and things to detox. That's really bad because your body needs some of that bacteria. Your body needs some things to work with. If you cleanse everything, you're injuring your body because your body isn't meant to work that way. So a lot of times, even in biomedicine, like I have friends who are nurses and doctors who tell me they meet people who do colon cleanses, right? Where they go and have a bowel movement and then like literally diarrhea and they sit on a toilet for a day. And afterwards, they're just fatigued and burnt out because you have no energy left. You just took good, bad, everything and just dumped it all out. Your entire digestive system has more gut bacteria than the amount of like animals on the planet. It's like billions, trillions of bacteria living in there, to help your body function right. When you take these things, you're not just taking out, the overnight poop or other things. You're clearing everybody. Everybody just dies. That only happens when you're sick, febrile disease, surgery, whatever. We don't like doing that.
It's people who have constipation.
With constipation, you don't want to purge too much. You want to take something to kind of help with the bowel movement, but once it starts, you have to stop. Like one of the things in Chinese medicine, we don't believe in constantly taking like something to purge. So there are some herbs, there are acupuncture point that helps you get bowel movement going, but we don't want to make that a habit because when you make it habitual, you're going to get prolapses. Like, and over time, it won't hold.
I
If you think
see.
about it, you have this so often, it becomes a natural response to just go. Your body stops holding. Holding and grasping is a primary function of your spleen, right? It helps to prevent things from going out. That's why a lot of times when they have too many babies, one after another, end up with prolapse. They'll end up with pelvic floor problem. They'll end up with leaking urination. Like as they get older, they'll even have like uterus prolapse, like organ prolapse. Yeah, it's because all that energy they use to push down, chi and blood leaves every time. Over time, it becomes a habitual thing. It just kind of falls. You don't have energy to hold it up anymore.
So you do think for people who have constipation, it's not good for them to take it for a year
No,
to clean out?
no, God, no. If you took it for a couple weeks, that's fine. A month, in my opinion, is pushing it. If you did it for a year, you're just asking for trouble.
Okay.
What happened is after a while, they may end up not being able to control their bowel movement. They'll go to the
I see.
they'll end up with loose stool or just things don't stay. It just flush out.
Yeah, because my son have constipation and we went to family doctor and they suggest to take for a year. After a period of him taking it, he feel he want poop, said, "Mommy, I want to go," but then it's already come out. It's too late.
Yeah, because when he feels it, he doesn't have enough chi to hold it. You take laxative for so long, the muscles don't have that chi to hold it up. It just falls. If you take it for a year at a time, and as a young child, as they get older, they're going to end up with prolapse issues, rectal prolapse, because in Chinese we call it the chi comes up, right? The chi raises, the chi descends now. It's sinking, and they're too young to be doing that. I would never do that for children.
So when do you think is a good time to stop?
You would only start it if it's chronic for a long period of time. They don't go for maybe 2-3 days. In that case, again, I would definitely consider using acupuncture and herbs at the same time. The most likely thing I would recommend now is, if you could stop, actually start with more dietary changes. One of the things is like sweet potatoes, like yams, pumpkins, squash, things that are considered in Chinese medicine more for tonifying spleen and stomach. They're easy to digest. They're good for the digestive system. They boost digestive functions, and they're also easy to pass. So you can start doing a bit more of that in the diet and see if that'll help a bit. One of the best thing with that is especially little kids, you can try to do more gua sha or even tui na. Abdominal tui na helps a lot in that case with bowel movement. And you can try moxa and see how that works. Without seeing your child, I can't really give you a recommendation one way or another, just because I don't know if it's heat-induced or cold-induced. So those are a little different in treatment. But if you did that, again, around the stomach, umbilicus region, usually that'll help get movement going. What we're trying to do is get natural peristalsis. So we want the body to naturally have movement. That's very important. When you take laxative, what it does is it doesn't help with the movement. It just kind of helps it drop, right? It just literally cleanses it. But it's not necessarily a cleanse. It's just getting your body used to like losing everything. So I would never recommend that, especially not on a kid. There are two types of patients I would be very wary of using laxatives. One is elderly and like geriatrics, and one is children. Because in both sides of the spectrum, kids, they're not fully grown yet. A lot of their organs aren't even fully developed. You do not want to give them harsh purgatives to kind of keep purging, because then the body is going to just be weak permanently.
Just come out before he can rush and go to the restroom. Is that because he take too much laxative?
Yeah.
Okay. So we should stop at that
Stop
moment.
the laxative. I would stop before that. Stop the laxative. Try to do some moxa. That'll usually help.
You mentioned gua sha. If I do gua sha, where I should gua sha? Like on his stomach?
I would say stomach channel. I would stick to the stomach channel for gua sha. You can also do the back. I wouldn't gua sha in the stomach region. I would do tui na. You can do tui na around the stomach. So you go in a circle pattern with just enough pressure that's not painful, clockwise and counterclockwise to help with the bowel movement, and then the other way to make sure it's moving. So we say with the movement of the stomach, the large intestine is to help go, and the reverse is to help harmonize. So in his case, I will go in reverse to help harmonize. So you can try that for a bit and see how that works. Because a lot of times, especially with kids, they respond very quickly to these drugs. So usually I would say if you did have to give them a laxative for any reason, a week would be the most I would ever consider. Anything more than that, that's just too much on their little bodies.
I see. You just helped me solve that issue.
Yeah.
Thank you. I think I'm going to try that.
Tried moxibustion and other things. A lot of times with kids, dietary usually helps tremendously, especially little kids, because their digestive system isn't fully online. Like before kids reach even 10, their digestive system is not online yet. That's why they like sugary things. They like greasy, oily, because their stomach kind of craves that kind of stuff. So the best way to replace that is to really use more natural things, naturally sweet, like sweet potatoes, squash, pumpkins, things like that are easy to digest.
Yeah, that's a very good point. For my kids, if they're already addicted to these candies, like my daughter is asking candy all the time. Mommy, I want candy. I want candy. I know this candy from the grocery store is not good for them, but in this case, they're already addicted to them. What should we do to stop that?
Well,
to change
they're
that?
gonna naturally want sweets. That's just normal for children, because so in Chinese medicine, sweets are things that help tonify spleen and stomach, and they are actually the fastest way for our body to get nutrition. Especially when their body's not fully online, trying to digest like fiber things, meats, vegetables are harder on their stomach. It is just harder to work. Our body likes the path of least resistance. That's just our human body. Like we want to do the least amount of work. So with kids, you can even make your own candy or make fruits, things like that. Things that are naturally sweet. Like honey is one of those things that you can like cut little pieces of fruit and add a little bit of honey to that, and that'll usually help. Kind of try to slowly adjust them into things that are natural and good. Like a lot of organic fruits are very aromatic. They're really good. And if they're not very sweet, you can add a little bit of honey, and that'll usually fulfill the sweet requirement for most kids.
Okay. Thank you.
Try
That's
that
very
first.
helpful.
And I've also seen people can bake sweet potatoes or other things. I even told a patient for a while, her kid has similar issue. Her daughter didn't like to eat food. I said, make it cute. Go online, all these blogs and things teaching you how to make things look adorable. Little kids, you make homemade candy, things like that, out of honey. Once it looks cute, they'll all want to try it.
I guess very cute candy ordered online. It's not that sweet because they get use of the very sweet candy from the grocery store and they taste it, they throw it away because it's not very sweet. They didn't get use of it.
Yeah, so it takes a little while, just in general, when you start working on their diet, just slowly trickle down the sugar. Sugar is by far the most addictive thing in the world. So one of the things to try to do in their normal diet is to cut down sugar a bit. Once you start cutting down bits at a time, the sugar you get at stores, I would just try to do less and less. I mean, I know it's a little hard because again, even with adults, weaving sugar is one of the hardest things. I have a lot of diabetic patients, literally trying to get them off sugary things like sodas, candy, or certain food. It's very difficult. But, trying to find replacements, supplements, things like that, step by step, it takes a while. It's a progressive thing. Once you get their body more accustomed to certain foods, especially dietary, other things, they won't have as much craving for the sugar.
And if someone come to you with these symptoms like the brain fog, maybe hair loss, what would you treat that and what does the process look like?
It depends. For hair loss, there are so many different things that can occur to cause hair loss. In Chinese medicine, we say it could be due to blood deficiency, blood stasis, due to wind, due to kidney deficiency, due to liver young rising. Like the list is long. So I have to see what's causing it, right, to treat that. Same thing with brain fog, usually that's due to phlegm missing the mind. There's different treatment protocol. It depends on what the combination is. Every patient varies, and that's very individualized. You have to ask them what other symptoms they have. If it's just hair loss, do you also have like lack of menstruation? One of the things, like if they have amenorrhea, they say, hey, I haven't had a period in a couple months, or, I'm noticing I'm anemic when they go get their lab results, then that would be on the blood deficiency category. If you had someone who's same thing, hair loss, other issues, they'll tell you, yeah, I get dizziness, I get vertigo, I get all these, have high blood pressure, and maybe due to liver young rising. Like, so it really depends on what the coexisting symptom. We don't look at it, say if someone comes in, yeah, I have this problem. It's not one problem. It's many other problems. They're all related. We just have to see
Okay.
which relation creates a diagnosis. So that's again very personal to each person. I have to know how you got here. Sometimes it could be due to work, stress related. Sometimes it could be due to familial, someone losing like a loved one or something happened. Sometimes it could be diet. Sometimes it could be you move to another country or you move somewhere else and diet changes or sleep changes. It is all very like personal and it's multifactorial.
Thank you. And last, do you have some suggestion we can do when we're at home to help like very common symptoms like headache when it comes? What we can do to help with that?
So right here, there's a pressure point. You can also try to find them online. This point is called
Okay.
focal. It's called Li4. This is the dominating point for headaches on the head. You can pressure on it and just press it yourself for about 3 to 5 minutes and just when you push onto it, look for a point where you feel tender. When you press,
Okay.
you'll feel kind of like a sore, tender sensation, and just that would be where the location is. And you can massage around that area. Let's say you can't really find it, you could just kind of massage this general area. Take your whole hand, just like
Okay.
right here or along the bone, just kind of massage this whole area. And that'll usually help with alleviating some of that pain. Like say you already have the headache, it's not as effective. This is more preventative. So even on a
Okay.
day you're likely to get this, just kind of massage it every day a bit. It'll help reduce the occurrence. When you do have them immediately, for myself, because I used to have migraines, acupuncture works really well. This is more for like a day-to-day thing. Another thing that you can do, especially frontal headache, usually has to do with the stomach. So usually it's either they had too much stress or ate food that's inappropriate. Usually in that case, I always tell people watch what you're eating. That'll help a little bit as well.
What kind of food they should avoid?
Kind of people, spicy food, greasy food, oily food, cold salads, icy.
Cold salad? No, I thought salad is healthy.
Salad, see, that's one of the thing about salads. I'm not going to tell you vegetables are not healthy, but this is one thing to take away. Let me ask you this. Little animals, if you try to eat them, they can run away. When you try to eat a vegetable, what can it do? It can't run away. So how do they preserve themselves? A lot of vegetables have different types of toxins, whether it's acid, base, or toxicity. It's self-preservation. So a lot of raw vegetable, if you look it up, you'll actually find out there are traces of things that's actually toxic to the human body. So in Chinese medicine, when we talk about nutrition, we generally boil a lot of food, like spinach, like kale. A lot of these, we actually boil them a bit to get rid of the acidic component in it. With certain things like nightshade, beans, other things, they do have toxicity in them. So we cook them and make sure they're cooked thoroughly. I see a lot of times when I'm in restaurants and where they serve like beans just raw, and I usually I just don't eat them. Yeah.
Okay.
And
I think.
I'm not saying it's you cannot have a salad. Like, for example, lettuce, romaine lettuce, cabbage, like a lot of things can be eaten raw, like cucumbers, you can eat them raw. Keep in mind, when you eat these things raw, they're very cold in nature, right? Your stomach has to cook them basically and warm it up. So for it to do that whole work, if your stomach has health issues already, if you have GI issues, it has to go through the extra work of cooking it, right? So if you're going to do that, you should always have some hot soup or a hot meal with the salad. If you're just eating a salad as a whole meal, it's really hard on your digestive system. Same thing with ice cubes, right? If you think about it, when you're chewing on ice, it cools, it drops your thermal temperature. When you wake up in the morning and have a cup of hot tea, it warms you up, gives you energy. When you do something cold, it takes away energy. If you think about it, when you're tired, would you drink ice cold drink? It makes you more tired, right?
Well, I see a lot of people do that in United States.
Yes, a lot of people, not just here, everywhere else in the world. I see it in China, like young people nowadays go get giant ice cold coffee in the morning. Think about it. Coffee is extremely hot. It burns through your stomach because of the high acid and the high bitterness. And then you do iced. You just shut down your daily function. Think about it. Your body's trying to warm up. It's trying to wake up and rise in the morning. You add cold things, it just shuts down. But when you do something warm in the morning, it kind of helps it open up, right? If you think
Mhm.
about it, when you are cold, when you're tired, when you're fatigued, do you really want a cup of ice cold drink? You want something warm because it gives you energy, not the other way around.
When I was giving birth, a lot of women right after they give birth to a child immediately have ice water because they get used of that.
Yes, it's first of all, it's a habit. Secondly, it's because of heat. Right after childbirth, women suffer something almost like a hot flash thing. It's from losing too much qi and blood. So when you lose too much of it, you get yin deficiency, leading to yang rising. So they'll almost feel a little warm. And the only thing they know in their head is to drink something cold. A lot of times people tell me they have stomach pain things. They feel hot in the stomach. They drink ice cold drinks. But after they drink it, it's even worse. Like people with stomach acid, people with acid regurgitation, heartburn. They'll say, oh
Mhm.
yeah, after they drink cold drinks, it doesn't make it better. Why? Well, because you think it's heat coming up. It's not, it's empty heat. When you add ice to it, it makes it worse. But if you drink something hot, it seems counterintuitive. It actually smoothes and reduces the acid production.
People make jokes that even in summer, Chinese people will give you warm water. They don't understand why. Thank you. You just explain it.
Yeah, you can even look it up because it keeps your body at a static temperature, right? When you suddenly add ice and other things, you're literally just introducing ice to that point. You drop it internally, but your body has to still warm it up. It takes more
Mhm.
energy. It creates more acid to kind of break that down.
Thank you. I grew up with warm water, warm tea. We have that kind of habit. When people ask me why, I don't really know how to explain that. But I think today you explained to us very well. I have learned a lot. I think our audience who have seen this video can also learn a lot and maybe change their little habits. Maybe in long term, their overall health benefit. Thank you so much.
I'm not telling you to stop drinking ice drinks. My patients who tell me, oh, they love certain things, I say, at least try a cup of warm water in the morning and give it a few hours. Just little
Hmm.
small changes. I have things that I do. I eat ice cream. If you ask any other older TCM practitioner, they'll look at me and say, what do you mean you do ice drinks or eat ice cream, right? They're not good for me. I know that. But once in a while, we kind of give in because it makes us happy, right?
Yeah.
So I always tell patients, make changes that you can do. Let's say you really like ice drinks. Well, at least in the morning, have a cup of tea, something else, like maybe have ice in the middle of the day or some other time, like just to kind of slowly introduce that in. As you start doing that, you will notice like little things that make you feel better. And once you make
Hmm.
changes that are easy to do, again, easy to do for you, easy adjustments, and notice these changes, you'll feel much better.
Thank you. When you mentioned earlier that a lot of people have fatigue, what's your suggestion for them? They get up in the morning, they feel tired, they are lack of energy all day.
So the best, easiest way they can do, cheap, free, convenient, they just have to do it, is soak in the sun. You have to make sure your back is fully exposed. For ladies, wear one of the sport bras or whatever, but make sure your back is exposed. For guys, you can just take off your shirt, go outside, stand in the sun, sunbathe. 10 minutes, no sunblock, just your back. So for those of you who will might say, hey, I have urticaria or, rashes, things, because sun problem, don't worry. When you do it to your back, it's not an issue. Make sure you cover your arms, your hands, and your head. I sunbathe in my backyard. It's not available. You can go to the park, lay on a grass or something, bring a blanket. It'll help about 10 minutes a day between morning until about maybe 10 a.m. After that, the sun is too hot. Don't do that during the midday. And then after about maybe 4-ish, 4 to 5, and then try that again until sun sets. Either of those times will do fine. I prefer earlier in the morning if you want energy in the morning. But if you want to sleep better at night and you want to kind of store back into a healthy state, you can do it later in the afternoon. Either way, sunbathing is one of the best way to have your body absorb the sunlight, reprocess, and give you vitamin D. Your body processes vitamin D best. And that'll also help with calcium breakdown and all that. You can look up on those research about biomedicine and sunbathing, how our body converts sunlight to vitamin D eventually. And other than that, in Chinese medicine, we say that as you absorb the sunlight, it raises the yang qi. And one of the things about adrenal fatigue that you mentioned is the lack of yang qi in the body. That's one of the easiest ways to absorb that.
Thank you. So easy and it's free.
Yeah, it is. You
Yeah.
just go outside, just on a sunny day. Yeah, make sure there is sun. I've tried it on different days. I've done it on days where, it's kind of cloudy. It's not as effective. You'll still get your vitamin D. You just don't get the same energy. I've had days where I would go outside and kind of rest for a bit. When I come back, you feel warm. It's the kind of warmth and the kind of feeling that you get, like very deep in your soul almost, that kind of gives you an energy.
I have learned a lot today. Very easy, understandable language.
A lot of times with doctors, things, trying to speak in words that patients understand are very helpful. A lot of times I think what makes it difficult is that most patients don't really know what something means and they're afraid to ask. Like
Yeah.
they really don't know what they have and it kind of is scary. But sometimes they're just medical terms. And if you really understand the mechanism and what causes it, it's reversible. A lot of things in medicine, even MDs and specialists will tell you some of these are reversible, some of these are manageable. It's just time constraints. scope of practice, other things, there's always that limitation. And it's not just in the US, it's everywhere else. That's a medical issue, and practices elsewhere in the world, everyone kind of is feeling that.
Thank you so much. Your information is really very helpful and very useful for me. I think for a lot of our audience too. Thank you so much.